Pyometra. It's the deadly uterine infection that kills dogs, right? But while spaying dogs reduces the risk of pyo, it increases your dog's risk of common cancers, joint disease, behavior issues, and research shows the longer your dog keeps her uterus, the longer she lives. So if you're not ready to spay your dog just yet, then I want to talk about the signs of pyo and how it might not be as big a deal as your vet says it is. Before we get started, make sure you subscribe to this channel, and if you're on YouTube, click the alert notification. Okay, so vets have crappy jobs most days, and I'll admit, most of the pyo cases that they see are too far gone, and that makes the recovery from surgery a lot harder, and sometimes the dogs don't make it. But I've had personally 5 dogs with Pyometra, so I have some experience here. And my experience is that, listen, you'll know if your dog has pyo, and you'll be able to get her to the vet in plenty of time for her to have a full recovery. Now, this video here is my bitey a couple of years ago, and I want to show you what Pyometra looks like so you'll know the signs. Now, the first thing you need to know is that there's 2 types of pyo, open and closed. And you can see here that bitey has open pyo, which means that her cervix is open. And this is good because an open cervix allows the infection to drain out. Most pyos are open, that's good. But if the cervix is closed, then the infection has nowhere to go. So if your girl is acting sick, especially if it's a month or 2 after your girl's season and there's no draining, then you can assume that it's a closed pyo, and make no mistake, this is a medical emergency. She can become septic within a few days, so I'd recommend getting her to the vet ASAP. But you can try to manage open pyos at home. I've done it myself with homeopathic remedies and a Chinese herb called Untitled. So hopefully you already have a good holistic vet on your side before your dog develops pyo, and she can guide you through at-home treatments because they can be successful. Now, the signs of pyo are pretty obvious, to me anyway. First of all, it'll usually, but not always, be a month or 2 after your girl's last season. And that's because pyo is caused by hormonal changes. Now, apart from timing, your girl will definitely feel and look sick. And she might be panting and restless because pyo's a bit painful. Now, the second sign I look for is a lack of appetite, or especially drinking a lot of water. Pyometra can sometimes look like a urinary infection, and if you leave it for several days, then the bacteria could also travel to your dog's kidneys and cause damage there. So if the pyo is open, you have a day or 2 or 3 to try to manage it if you've caught it early enough. But you don't have days and days and days. Finally, what you're also going to see is your girl will be licking a lot. Now, the very first thing I do when my dogs get pyo is take their temperature, because this will give you an idea of how well they're managing. Bitey's temp was about 101 during this video here, and 101 to 102 is normal for a dog. Once they hit 103, then you know they have a fever. And if it climbs up to 105 to 106, then it's getting serious. For me, I try to manage pyo at home, but if and when the temperature climbs over 104, then it's time for professional help. Now, I just use a baby thermometer to take the temperature, and I do the good old-fashioned poop shoot way. It's the most accurate. You just might need to put a little lube on the tip of the thermometer, but most dogs don't mind. Now, with bitey, I used homeopathic remedies like pulsatilla, and I also use Untitled. And I've been able to avoid emergency spays in the past with these, but this wasn't bitey's lucky day. At first, I thought she had a urinary tract infection, and that prevented me from being able to start treating the pyo early on. And the earlier you treat it, the more success you're going to have with home remedies. Now, bitey's temp kept slowly climbing over the next day and a half, and when it got to 104, I knew it was time to take her to the emergency vet to be spayed. I'm all for avoiding surgery, but my goal is always to keep my dog safe and happy. I'll admit, spaying your dog during PIO is more complicated and more expensive than a routine spay. And an emergency spay is even more expensive, especially if you request a board-certified surgeon. Now, I asked for a board-certified surgeon for Bitey, and the surgery cost me about $4,000. For me, I can afford it, but if I couldn't, then I'd consider health insurance, or better yet, just sock away some just in case she gets PIO money. So I'd be prepared for an emergency. But listen, most girls go their whole lives without Pyometra, so don't think it's 100% going to happen to your dog if she isn't spayed. Now, this is important. You might be thinking, why wouldn't I just avoid the risk of PIO altogether and just spay my girl now? And that's what your vet would probably want you to do. But spaying increases your dog's risk of dangerous cancers like osteosarcoma and hemangiosarcoma. Also, on the whole, the longer your dog keeps her uterus and her ovaries, the longer she'll live. There was a 2009 study done by the Gerald P. Murphy Cancer Foundation, the home of the Center for Exceptional Longevity Studies, and they tracked the oldest living dogs in the United States. Now, they collected data on Rottweilers in the US and Canada who lived to 13 or more, and they compared them to the Rottweilers who lived to about 9, which is the average for this breed. And they found that female Rottweilers who kept their ovaries for at least 6 years were 4 times as likely to live to 13. And dogs who were spayed in the first 4 years of life had no advantage at all. And this has been shown in humans too. Now, the way I look at it is Bitey got to keep her ovaries for 8 years. That gives her the best chance at extraordinary longevity. If that's what you want to do for your dog, then it's important to not surgically remove a quarter of her endocrine system and expect a good outcome. In my opinion, spay should be an emergency surgery only and not routine. If you're responsible enough to have watched the end of this video, then you're probably responsible enough to have an intact dog and not have unwanted litters. Just make sure she's supervised when she's in season and there won't be any danger of mistake puppies. Now, if you have any questions, just leave a comment below and check out the links for more information. And if you like this video, please make sure you like it, share it, and tell people about it. Thanks for watching.